So we treat where the immune system doesn't sort of settle itself back to normal. The immune system needs to have two parts. It needs to be able to ramp up to attack the virus or the bacteria. And then after the threat is cleared, it needs to settle itself back down to normal. If it doesn't do that, you then have an issue where the immune system is attacking, but it's not really attacking anything with any great purpose, and it sort of turns in on itself. And what you end up with sort of a lot of areas that can be sort of damaged based on that unchecked response. The most common is juvenile arthritis, and that's about 1 in 1,000. Lupus is probably the next most common in this part of the world. We're a lot better than we were, even as recently as 10 years ago. The amount of medication options and things like that have expanded tremendously, and they continue to expand. What I like to reassure people is that I'm going to do my best to make sure your child doesn't have any changes to their life sort of expectation. I expect them to go to high school. I expect them to go to college. I expect them to get a job and have a family if they choose to. I don't want that to change based on sort of me having to give medicines or me having to get asked for extra tests. I think that's probably the most important thing to come across.